I'm deeply troubled with some of the findings of the report. We provided a forum for Albertans to express their experience, whether positive or negative, about the effects of supervised consumption sites on their homes, business, and the communities. What we heard was a wake-up call. From increases in social disorder to discarded needles to the near absence of referrals to treatment and recovery, what we see is a system of chaos. Chaos for addicts who desperately need help getting well, and the chaos for communities around the site.
This study has been eye-opening for us in taking a look at what's happening in our communities and the complete disorder, particularly in the surrounding areas around these supervised consumption sites. It's unacceptable in the province of Alberta. The rule of law needs to be upheld. And too many of these areas where you have effectively a blackout zone or no-fly zone for police services is not acceptable. We need to make sure we have a consistent approach in the province of Alberta. We're going to be working with the police chiefs across our province to make sure that we have a consistent approach in this province to ensure that the rule of law is upheld. All Albertans deserve to feel safe, regardless of where they are in our province. They need to make sure that our communities are safe.
It is clear to me that Albertans care about their neighborhoods and their neighbors and their communities. Many community members spoke passionately about the changes in their communities since the opening of the supervised consumption sites. Predominantly feedback, as you now know, showed these changes had a negative impact. Among the committee's key findings, in every community, residents reported an increase in needle debris on public and private property in the neighborhoods surrounding the sites, and the perception of decreasing safety and increasing crime by all the community members. Another issue that we found as a committee was that methamphetamine use accounts for up to 50% of the drugs consumed at the sites, something these sites were not originally designed for. This was surprising and seemed antithetical to the purpose of the sites, which is to address the opioid crisis.
This is a government that created a new ministry whose sole mandate is designated for mental health addiction. This is a government that committed $140 million at a time our province is still struggling economically for the cause of mental health addiction. This is a government that we committed adding additional 4,000 treatment and recovery spaces over our mandate. And this is government that within 9 months in our mandate, we already accomplished 3,000 of those 4,000 spaces that we committed for. So make no mistake, we are seriously looking into how to support this, but we need to do it in a coordinated fashion that need to align to what's the goal, what's the end goal we want to accomplish. And I'm very proud to say that we took a direction, you hear Premier talking about this over and over. We're committed to building a recovery-oriented system care that covers all the way from prevention, intervention, treatment, and recovery. So if you're referring supervised consumption sites can be one of the tools there, absolutely, absolutely, can be. But it has to be aligned to the direction that what we want to accomplish in the end of the day.